All right, ladies and gentlemen, BioPA here with 911 BioCare. We're going to do a quick tutorial today about injectable medications and the proper procedure for injecting them. So the first thing we're going to talk about is a traditional way of doing your injectable medications, where we use kind of a regular size syringe, probably about a 3 cc syringe with your normal size needles. So generally what you're going to do is you're going to have what's called a loading needle, which is going to be a bigger gauge needle that you're going to draw the medication up with, and then you're going to change out to an injection needle, which will be a smaller needle, which is more comfortable and is going to be much sharper because you haven't penetrated the vial with it yet. So we're going to take our sterile syringe here, we're going to take our medication, and we're going to grab our alcohol wipe and go ahead and clean off the top of the bottle. Then we're going to take our syringe here with the loading needle, take it off. A lot of times we'll introduce a little bit of air, so we'll pull back a little bit on here to put some positive pressure into the vial. We go ahead and put it in, and then go ahead and draw back our dose. So let's say our dose is 1 ml or 1 cc. We go ahead and pull that back, and there we go. There's our dose. You can carefully put the cap back on here. We take off the loading needle, and we put on our injecting needle, which is much thinner. And then we can go ahead, take your alcohol wipe, clean off the injection site, and then go ahead and give your injection. So that's one way to do it. That's a traditional way. Now, there are some times when we may take a medication and we may use a much smaller needle, and we may inject a small amount of that medication every day or more frequently, and we can use a much smaller needle in that case. In this case, what we have here is a 31 gauge insulin needle. This is about as thin as needles get, and what I'm going to show you is you can even draw up, contrary to popular belief, you can draw up an oil-based medication with a 31 gauge needle. Okay, so same thing, we're going to go ahead and take our needle, we're going to pull back, introduce a little bit of air in the needle. I like to do it with a cap on, so we kind of minimize any dust that we might pull in there. And then we're going to go ahead, put it into the bottle, inject our air so we have positive pressure. It's very important here to have that positive pressure because it'll really help you out. And then you're going to go ahead and just pull back on the plunger until you're about halfway in the syringe here. And that's going to induce enough pressure. Now see, I don't know if you can see this up close, but it looks like there's nothing but air there, but it's actually pulling medication in very slowly, and we just have to be patient. So it's going to take, probably about 10 or 15 seconds here. And as we talk, the medication is going to slowly come into the syringe. I'm going to show you it doesn't take forever. The benefit of doing this is that when you use a much smaller needle, like a 31 gauge, the pain goes down quite a bit. And when you're injecting medications, a little bit of a medication every day, it also, and see, we're done. Boom. So there's almost 0.15 mLs of an oil-based medication in a insulin syringe with a 31 gauge needle. Okay, it does work. Now, with this 31 gauge needle, you can now inject almost any site. You can inject in the thigh, you can inject in the tricep, you can even inject in the abdominal fat, kind of like a diabetic, depending on the medication. But it opens up a lot more options for you, and it becomes much more comfortable as well. So I hope that this helped you out, and we're looking to educate you as much as we can and make it easy for you. So look forward to some more videos from us. Once again, this is BioPA from 911 BioCare. Take care.